This is all about communication, part of the early years project. In this video, we will cover developmental milestones for communication. As a disclaimer, before we get into the milestones, it is very important to note that milestone expectations vary greatly between medical professionals, schools, and early education providers. Um, I will note that all of these milestones were taken primarily from the American Speech Hearing Association, which is the national organization for audiologists and speech language pathologists. So please keep in mind that it is important to use the milestones for your school district or your organization, whichever you are closely associated with. We'll start with communication milestones, 0 to 4 months. So, from 1 to 2 months, we want to see little infants looking at your face. They're going to react to loud sounds and they make some sounds other than crying. From 3 to 4 months, they may smile, look at you to get your attention, and they're looking to keep your attention. Now, from 5 to 9 months, we'll talk about these a little bit more in detail. So, 5 to 6 months, they are taking turns making sounds with you. Again, that back and forth communication feedback loop. And again, not clear, true words, but they're learning that back and forth. We may hear cooing and making different sounds, like babbling. So that may sound like ma 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 ma, ba 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 ba. From 7 to 9 months, they are going to show different facial expressions. They may smile or laugh when you play peekaboo with them, or they may communicate through lifting their arms, wanting to be picked up. From 10 to 26 months, we'll talk about these a little bit more in detail now. So, from 10 to 12 months, they may wave or point to something they want or point to say that they need help. Again, not using those words, they're using more gestures. And from 16 to 18 months, they point to show you something of interest. They follow direction of your eye gaze or head turn. So if you look at something, they're going to look at it too. From 31 to 36 months, up until this point, these skills are continuing to develop and they're starting to use more of the verbal communication, which really falls more into the language milestones, which we'll cover really in depth. How many words are they using when, or what kinds of words are they using when? All of those skills really fall within language. So we will cover those in the language milestone area. But from 31 to 36 months, they will talk with you in a conversation using at least two back and forth exchanges. So from 2 to 3 years, we'll touch a little bit on some of the words that they're using. They'll use two or more words together. They may use words like I, me, we. They follow two-step directions. They ask questions. They start to answer questions. From 3 to 4 years, they say sentences with four or more words together. They say some words in a song or a nursery rhyme or a story, and they can answer simple questions like, what is a crayon for? What color is this? If they know their colors, we can't base their ability to communicate whether or not they know the correct color. They're still learning at that point. Um, Communication milestones from 4 to 5 years. Again, these also really tie into language at this point because remember, talking about communication, communication is the foundation that we build language on. So, really, a lot of the true communication milestones we're going to see within the first 1 to 2 years of life. Those skills are going to be developed. And then any kind of communication development after that is going to fall more in the language area. So, again, these milestones are really falling more in the language area, but just to kind of have an idea how they're using those communication milestones now, they may tell short stories. They can follow three or more stepped directions. They're asking why, what, where, who, and how questions. They're very inquisitive, and at this point, they're learning names of letters and numbers. And finally, from 5 to 6 years, they are following multiple step, unrelated directions. They are following and understanding simple conversations. They're learning rhyming words. They're asking meanings of words. And they're playing cooperatively with others to assign roles in games. So, like I mentioned at the beginning of this video, a lot of the milestones for these communication and language skills were primarily taken from the American Speech and Hearing Association. We also compiled milestones from the Centers for Disease Control and Prevention, so the CDC, as well as Children and Young People's Health Services. So let's talk about signs of delay. And it's really important to note that as a child is maturing and developing, we're still going to see a little bit of a difference in every individual's development of these skills. So try not to get too worked up if a child is 1 or 2 months of what we would expect from a 10-month-old. I would suggest that you reach out to your primary care physician, a local speech and language pathologist, or early childhood educator, somebody if you do have concerns. But we will get into that with referrals. So, before we get into that a little bit more, we'll talk about signs of delay. So, first, what is a delay? A delay is identified through observation, assessment, and comparison to typical developmental norms. Again, we are looking to professionals in order to identify or really say if a child is presenting with a delay in any kind of area. So, potential signs of delay. And again, please remember to reach out to a professional if you do think a child you know or your child is presenting with possible signs of delay. From 3 to 4 months, they don't smile to get your attention. They're not really looking at you or making sounds to keep your attention. By 12 months, they don't really use gestures like pointing or waving. At 18 months, they are using gestures more than vocalizations or verbalizations to communicate. And by 18 months, they are also not following directions of gaze. Again, that would be if you're turning your head to look at something, they are not doing that by 18 months of age. So, referrals. So, you do have concerns of potential signs of delay. So, what do you do? If you have a child or you know a child who may have a delay in communication, well, there are a couple of options. The first one that you can pursue is contacting the primary care physician. So they can refer if they see signs or delays. It should also be included here that this could also include your pediatrician. Um, but if they have concerns, then they can make a referral to an early intervention or early childhood program. The next area that a lot of people don't realize is that caregivers can refer for early intervention, where if you access this link in the middle box, that's also on our website, um, they will provide a free assessment. And then from there, if a child does demonstrate a significant delay, then they would be available or they would be able to participate in free services in home, which is what early intervention is. And then the last area or the last avenue that you could pursue is the Department of Health and Human Services. So each state has a different Department of Health and Human Services. So if you go to Head Start, this link is for Illinois. But if you again search Department of Health and Human Services for your state, you can enter your zip code and then it will pre-populate different programs and different organizations near you to kind of explore more assessment and treatment options. So that concludes developmental milestones, potential signs of delay, and referrals. This project, the Early Years Project, is funded by Illinois Eddy, as well as Illinois Hands and Voices Guide by Your Side. We invite you to use your phone camera to scan the QR codes presented on this slide to give us feedback and how we can better develop these educational resources. Thank you.